The International Alliance of Patients Organisations is a unique global alliance of patient groups representing all nationalities around the world. And our aim, our vision is that patients will receive healthcare that meets their needs and their wishes and their preferences wherever they live in the world. And we work towards this in two ways really, both by working very closely with our 200 member organisations, and we provide them with resources and training opportunities to increase their capacity to be able to have an impact on healthcare policies in the regions that they work in. But we also listen to them, consult with them and work with them so that we can present a strong patient voice and advocate at an international level on relevant healthcare policy issues, and those include improving patient safety, increasing access to quality treatment and services, and also improving patient information so that it meets patients' needs. It's been great to see the developments that IAPO's made in the last 3 years. And when I say IAPO, what I mean is the collaboration between our 9 governing board members from around the world, our 7 staff, and our 200 member organisations. And together, and in particular with the regional strategy that we've implemented, we've seen a global patients movement where there has been an increase in the networking between patient groups, the way they collaborate on a regional level in Africa, for example, and Latin America, and the Western Pacific and Asian regions, and the ability of patient organisations to be a real partner in developing healthcare solutions with other stakeholders. The biggest challenge for us all in healthcare is the increase in the rise of chronic conditions that are affecting patients in all regions of the world. And what this means is that we need to have greater engagement of patients personally in their healthcare, because chronic conditions affect you throughout your life and you need to be able to make behavioural changes to lead a healthier life. You need to be able to manage your condition and take your treatments appropriately. But we also need to see greater patient involvement, because without healthcare policies focusing on the individual rather than the disease, we're not going to be able to deal with the burden of chronic conditions. From a personal perspective, I'm passionate about people being involved in decisions which affect their lives. So in terms of healthcare and medicine, we see the great potential that advances in technology have to improve health outcomes, to improve people's quality of life. And therefore, I believe that people need to be involved. I believe it's morally right for them to be involved in the decision making, both at the policy level and at the individual level around the implementation of those technologies. And so I think there's a far greater role that can be taken by people in society in healthcare policy making, and that's what I want to see. If I could make one real difference to society, I would like to see that no health policies are developed without those that are affected by health policies being involved. And so by that I mean patients and patients' organisations. And I think if we could just achieve that one objective, then we'd be in a really good position.